Good evening, everybody. Happy January. Let's start with our call to order. Well, this is our call to order, our roll call.
Okay, I'm just gonna go in order because it just seems the easiest flow. Brett Kiley,
Here.
Dr. Lisa Winkler,
Here.
Dr. Sheila Menke, Jeremiah Linneman, Dr. Dee Dee Gillum, Dr. Kylie Weidenbach. Oh, Kylie. Yeah, I apologize. Well, I'm looking at your name tag and we didn't put a doctor in front of the Kelly, and I think that's because there's not enough space. Dr. Kelly Weidenbach, Levon Hupfer,
Here.
Michelle Harris, Dr. Darcy Martinez,
Here.
Brian Halavasek,
Here.
Dr. Suzuho Shimasaki,
Here.
Michael Youngho, Adam Anderson,
Here.
and we have our medical officer, Dr. Bernadette Abeles, and from the county attorney's office, the assistant county attorney, Melissa Seger.
Here.
We also have a variety of guests and other staff present, a few that are online. So let's start with the onlines. Adam?
Two folks from our emergency preparedness and planning program, Lisa Olivito, and then Jennifer Zawaski.
And you also have one behind you.
And Luca Bernazzi, who is on our data team.
Thank you. So Zuho, would you like to introduce your additional staff members?
Dave Rodriguez here, our regional health connector, who also oversees or is leading part of our lead program that she'll be presenting on.
And, oh no, sorry, switch divisions. Like, where have I been? Michael, would you like to introduce your additional staff? Okay, and Darcy.
Yes, I'd like to introduce Lena Gancho. She is a nurse, public health nursing. She's our child fatality and prevention nurse.
Okay, thank you.
Awesome, thank you. Review and approval of the agenda. Anyone have any changes that they want to make? We don't have to vote on that. Okay. Approval of previous meeting minutes. Everybody had a chance to review last month's minutes. Any changes?
Motion approved. Second.
All in favor?
And for a point of order, just so I could ask Melissa with the board present, if the board does have changes that they would like to make to those meeting minutes, can they send me those in advance of the meeting? Or do the changes need to be made during the meeting?
They can send them to you in advance, and I would just acknowledge them. We would usually vote on it in the meeting. So
Okay.
if there was if the official agenda had been posted and we wanted to change it, then we just do a quick.
Okay.
Any objection to
Mhm.
this, but you can send them ahead of time.
Okay, that's what I just wanted to let you guys know as well as for my awareness, that if you do see anything, just please reach out to me.
Next on the agenda is our proclamation for National Radon Awareness Month. Kayla?
Yeah, I can briefly introduce Kayla. Kayla Lesperance is our public health and industrial hygienist. She's online and we'll just share a few comments and remarks before then we read the proclamation. So Kayla, can you hear us okay?
Yes, I can hear you. Can you hear me?
Yep.
Awesome. Thank you, everyone. I appreciate you being here and for proclaiming January National Radon Action Month. We are giving away free test kits to the public for National Radon Action Month in January. So we would like any of the public or members of Adams County staff to go ahead and order a free test kit. It's important to test your house in the cold months because this is when radon is most common. So here are some known facts about radon. It's often mistaken for carbon monoxide in homes, but there's no alarm detectors like carbon monoxide for radon, so you don't know if you have it, and it's not common to see this in housing codes. Breathing radon gas exposes sensitive lung tissues to radioactive gas, which can lead to lung cancer in the long term. And about half of homes in Adams County have high radon levels. So it's really important. You don't know home to home, neighbor to neighbor, neighborhood to neighborhood if you're going to have high radon levels. So it is really important to test your individual house. And then the only way to know if you have high radon levels in your home is to get a radon test because you can't see, smell, or taste radon. I would also like to thank partners in building departments who've adopted building codes to minimize radon in new builds. So there are now 43 towns or cities and 22 counties who have radon resistant new construction housing codes. And that was performed by building departments and public health action. So thank you again. And I hope that this January we get rid of all of our test kits, and Happy New Year to all of you. That's all I would like to say. Thank you.
Thanks, Kayla. And so I guess I get to read the proclamation. This is the proclamation recognizing National Radon Action Month, proclamation number 2025-001. Whereas radon is an invisible, odorless, radioactive gas that threatens the health of our residents and their families, and whereas radon is a leading environmental cause of cancer mortality across the United States, and whereas the Colorado Rocky Mountain region has been ranked as a Zone 1 area by the U.S. Environmental Protection Agency, meaning the region has the highest potential for elevated radon levels in homes, and whereas Adams County residential radon testing data shows 48% of Adams County homes tested as being at or above the U.S. Environmental Protection Agency radon action level of 4.0 PCI/L, picopurities per liter of air, and whereas any home may have elevated levels of radon, even if homes in the same neighborhood do not, and whereas supporting recommended radon practices and policies to reduce radon exposure is important to protect our community's health and welfare. And whereas testing for radon is simple and free test kits are available to the public for the month of January, and if elevated levels of radon are identified through testing, they can be fixed. And whereas Adams County Health Department, the Colorado Department of Public Health and Environment, the U.S. Environmental Protection Agency, and the American Lung Association are supporting efforts to encourage Americans to test their homes for radon, have elevated levels of radon reduced, and have new homes built with radon-resistant features. Now, therefore, let it be proclaimed that the Adams County Board of Health recognizes National Radon Action Month and the importance of practices and policies to reduce radon exposure here in Adams County, Colorado. Upon motion duly made and seconded, the foregoing information was adopted by the following vote, which is approved and approved. Motion to approve. Thanks. Second. All in favor?
Aye.
Hey.
Thank you very much.
Moving on, monthly financial report, Michael.
Should be coming up on the screen. Short. All right, cool. So, maybe be the last time we look at this one. There's some changes that are, that I've made that will include the request that were made a couple of months ago, so we can start looking at comparison between months across years. And so right now, this is our spending as our current expenses right around 27 million. That number will continue to shift as we continue through January into February, as a lot of adjustments are being made on the accounting side, on the back end, and things that like some things that paid in January, just like their invoices, and so they have a date, so I have to post them back. And so all of that stuff is happening between now and mid-February at the county level. And so hopefully by the February meeting, everything will be settled. If it's not, then we'll just show what we have at that point, and then we'll catch up in the March meeting. But we'll be able to start showing the expenses from January 2024 next month. This January. And so there's a couple of pieces in terms of postings of some refunds that we got. that need to be shifted and adjusted around. And so our accounting team is working on it right now. So also that will change some of the numbers too, and also leads to weather variance for December. Which way it does it overstated about 375 and say those things okay, that'll flatten that out a little bit in terms of sticking there. But other than that, everything's pretty good. Purchasing extra like operating supplies that we've been using at the beginning of this year and trying to do our first quarter just so we have them on hand, so you don't have to like rush trying to order things right now for at least for the month. So other than that, it's pretty solid. Any questions about what's up?
Thank you, Michael. Moving on, we have policy and legislative updates with the other Michael.
Hello,
No slides?
how's everybody doing? No.
Okay.
Full house. Wow, pressure's on. No presentation today. We're kind of tinkering with the format compared to previous years, where I feel like we've gone a lot more into like the weeds, into the specifics of a lot of the different legislation and policy that we were looking at or that we take positions on. You'll still get all that in like the weekly updates, a list of what we're looking at, what we've taken positions on, etc. But I intend to at least play with making this a bit more high level, and probably a lot shorter. So legislative session has begun, as we're all aware of. We've jumped right into it. A lot of that has been doing some stuff with staff. We did a legislative meeting last week, kind of a kickoff with our staff to build up some enthusiasm and things like that. Also just update everybody on what to expect in the upcoming year. There's a recording of that. It went out last week in the newsletter if you didn't see it. So feel free to click on that and you can watch that for some more information, including from our lobbyist, who I realize has never been here and none of you all know. So yeah, he's a really good person who knows what's going on. So feel free to check that out. Generally speaking, as always with the first weeks, it's just a lot of pomp and circumstance. It's a lot of procedural stuff. It's also the first session of the General Assembly, right? So it's split into two-year terms, basically. So in this first session, there's always even a little bit more pomp and circumstance. You've got a bunch of new legislators, right? You have to swear in. You don't have that next year typically, unless vacancy committees. So they're currently going around right now. Part of the pomp and circumstance was the governor's stay at the state. If anybody caught that, kind of outlining his priorities for the upcoming year. It's his second to last one. Next year will be his final state of the state. Nothing too surprising in the state of the state. We talked about how Colorado is going to work with the incoming federal administration, that he's willing to do that, except where it hurts our people. Talked about government efficiency and chainsawing through a bunch of old executive orders. Talked about immigration policy, being supportive of policy that was going to stop the inflow of drugs and illegal immigration, but also supporting pathways to citizenship for our legally resident Coloradans. A bunch on housing, improving access to introductory housing, transportation, energy, and climate were big themes again. A couple committees have begun, but they're just pushing through like procedural bills with a lot of the pomp and circumstance that they do. So have to pass a procedural bill. Like today we had the State of Tribes, where they bring in our tribal leaders, and they present on the state of the tribes to our legislative leaders. What else here? Oh, SMART Act hearings. So that's what's going to be happening for the majority of the next couple weeks. SMART Act is the process we have for government agencies to kind of come into legislative committees and report on their progress from the year. They make progress reports and update what's happened in the last year, how are X, Y, and Z programs functioning. And they're pretty informative, but they just take up a lot of time. So that's going to be kind of a majority of what's going on for the next couple weeks. We have 22 brand new legislators that are all drinking out of a fire hose. It's kind of interesting to see the dichotomy with the new legislators who just got here, who campaigned on doing a bunch of different really important stuff versus the people who've been here for a while and who know the budget's in a pretty bad place. So a lot of the newer legislators are saying, well, you know, I'm still gonna run the bill. I told my constituents I was gonna do it. That's what I'm gonna do. So they've got those bills. A lot of the more senior legislators, not necessarily, you know, thinking it's wise to use their time, you know, writing and trying to pass bills that aren't going to make it if they have a fiscal note. Vacancy committees, we talked about this last time, 29% of the legislature. We just had like a marathon week last week where Representative Judah moved from the House to the Senate, and then a vacancy committee selected that seat, and then they selected her replacement in the House. There was a vacancy committee hearing in one of Denver's district. Matt Ball, who's Mike Johnson's policy director, won that seat over a couple of different incumbent legislators, which is interesting. Democratic agenda, you know, they do a lot of opening speeches and everybody talks about, you know, the leadership talks about what to expect. Housing remains number one. Cost of living and affordability is right there as well. Childcare has been a really huge area of emphasis. Democrats are rallying behind, or some are rallying behind a bill to strengthen the right to unionize, which you may have heard about. That's like a really big wedge issue between the legislature and the governor, maybe. And then there's a ton of discussion about if and when the Trump administration, you know, takes over on the 20th, within a week, what can Colorado do to insulate ourselves? So they've got a couple task force looking at how to insulate ourselves on the environmental front with all the progress we've made. If the EPA were to not exist tomorrow, there's also an immigration task force. Senate Bill 1, which is where you can tell like what the kind of priorities of each chamber are by the number of the bill. The first bill was voting rights, so they're also very invested in protecting voting rights. Republicans have been very outspoken about saving people money. They just unveiled a really big omnibus platform yesterday. It mostly involves just eliminating legislation that's been passed in a few years that have raised fees. So they want to eliminate delivery fees, shopping bag fees, utility fees, gas fees, short-term rental car fees. You kind of get the idea, and you know, assume that all of those fees piled on top of people, something along the lines of $4,500. They also want to eliminate the ability of a local government to do local sales taxes on nicotine, which I thought was interesting. And the protecting Tabor is the big thing, especially as we enter into a really fraught budget year where some Democrats are getting pretty antsy about how restrictive Tabor could be, right? It's because it's not that we can't raise the revenue. The revenue's there. We just can't retain the revenue because of the cap Tabor. In the public health world, you know, there's still a lot of bills that haven't been introduced. I think the election had a big something to do with that. Everybody was out in their district campaigning, knocking doors, and maybe not as focused on getting their bills buttoned up. But we expect a bill on Medicaid redeterminations, protecting new programs like OmniSalute and Cover All Coloradans is a really big one that folks are focused on. There's a couple really important bills we're looking at that come from the Behavioral Health Interim Committee on like parity between physical and mental behavioral health coverage. 340B legislation, I know some of you might have heard about, which still isn't introduced. And then finally, I think the state budget remains kind of elephant in the room. 600, depending on who you ask, it's another between 600 million and $1 billion shortfall. It's actuarially closer to like $600 million, but then we just passed the initiative to fund $350 million to train and recruit police officers, which we have to fund from the general fund. Not all at once, thank goodness, so we can parse that out, but somewhere between 600 million and $1 billion. Also important to remember that our budget, when you look at it, about a third of it is Medicaid, about a third of it is K through 12 education, and around 15% is prisons and higher education. That leaves a pretty small chunk left over to kind of pick and pull from when you're trying to close $1 billion gap. It's a structural deficit. It's caused, we've talked about it before, but Tabor restrictions, inflation has gotten better for us consumers, but that means we can retain less money because that's one of the factors for how big our state budget can grow is how big is inflation. When inflation comes down, we can retain less money. Increasing Medicaid costs is just a huge one. And then some ARPA programming that we stood up that we don't have recurring funds for anymore. And it's important to know, I guess, just directly as our interest, that there is a 5% cut proposed in the governor's budget to the flexible funding for local public health agencies. That's the money we fought really hard last year to get an increase of, really for the first time this century, which is important because it's flexible. So it's not categorized. We can really use it anywhere that we want. So there is a 5% cut. Our lobbyist has been working really hard with the Joint Budget Committee to make sure that they know the value of local public health agencies, and I think they're there. Rep. Byrd's a huge advocate for us. Senator Kirkmeyer as well, Rep. Taggart for Grand Junction. The governor's solutions to this budget hole: privatize Pinnacle, the workers' comp agency, messing with the education funding formula that we just kind of right-sized last year after we got out of that budget stabilization gray area. There's a freeze on Medicaid rates and a select clawback of a couple that we increased last year. Smaller things like capping interest from cash funds and like rolling over that interest into the general fund. 5% cuts to agencies. A lot of that is just in positions that haven't been hired. The legislature is trying to come up with, the JDC really likely is trying to come up with their own solutions and asking the state departments to come back with more meaningful cuts. But they got a ton of work to do in the next 3 months to go really program by program to get us to a place where we can pass an even budget. So, with all that said, anything pop out or stand out or any questions, comments, concerns?
A lot of concerns.
Yeah.
Yes, but
Yeah. Great. As always, I'm available. Text me, call me, whatever. But great. And if you would prefer the old way where there is a PowerPoint, we do some of like the more closely looked at bill analysis, let me know. We can get back into the if you want. Diana might not like that.
Hey, Diana's not in charge. It was, this is just suggestions. We were just working through this together. I'm not in charge.
Yeah.
I
Cool.
just listen to a lot of feedback.
Uh-huh.
I get a lot of feedback. Lots of feedback.
All right, thank you.
Thank you. Great, we've got the executive director's report.
I don't think a bunch of things have changed since we last met in December, but just wanted to give an update on our capital improvement project request. We were notified by the county that our project, which kind of entails a number of things, including consolidating our western leases into one location and finding more space that is more adequate. And we're still asking for generators, and then we have the east side, kind of a rural location also on the list. Our proposal was approved but unfunded. Given potential shortfalls of the county budget, and they've said they would re-look at it kind of the end of Q1 this year. But they've also asked us to look at using existing funds both in our operating budget and in our fund balance to potentially get the same job done, particularly on the western lease consolidation and site expansion. So Yvonne and I just met with the new deputy county manager, Kristen Sullivan, and Amir Kahir, who's our facilities director, on Tuesday to just talk about some strategy there. And so we're going to be crunching some numbers and looking at, essentially like what we have in our operating budget now for our leases, for those 2 leases specifically. And then what is in our fund balance, could that be used to help, identify a new site, lease that new site, do the tenant improvements required to get us up and running, and then cover, you know, future lease in a new location. Or, you know, we still might need to do a budget request for operating, because lease expenses come out of our operating budget, not other funds. So just sort of looking at how that those numbers might shake out and looking at sort of those market rates. Michael is great at reminding me and everyone involved in the facilities team that our lease on our Westminster site, which is our largest clinic location, as you all know, is going to be increasing substantially because we are way under market rate. And so there's increases to our leases no matter what, but if we can find a better location, consolidate those 2 less than ideal locations and find a better location for approximately the same price or maybe a slight increase. We would be able to do that without those capital funds. So we're going to be working on that with the facilities team, and I think there are 3 primary locations right now that they are considering for us. There is the county has been looking for a long time at the St. Anthony's North former location, and has considered purchasing buildings or leasing, and there's been a lot of county interest in that campus for a while, and not just for us, but for other purposes and other services. So that's still just being considered more on the leasing side at this point in time, because I think with the county budget, there's not a lot of money to purchase the buildings. And then there's a building called Plaza 36, which is off 70th and Broadway. It's very close to our North Broadway office, right over there by the Eatai's restaurant. And so that building also has been of interest to the county for quite some time for, again, potentially us or other services. And then there's a building off of Highway 36 and Interstate 36 in Sheridan. Used to be mall location. Yeah, West Park is the name of the building, and we really favor that location for a number of reasons, but the facilities team is starting to arrange tours for us. And then, yeah, we just need to do some number crunching and see how we might be able to cover that with existing funding. Of course, yeah, future state looking at Aurora, East Side clinic location is still like something we'll be asking for and is in facilities master plan for the county. That might be in future years. So we're just chipping away at it. And I've been trying to convince the county manager's office that we are low hanging fruit, that we're not asking to build a building, purchase a building. Our request is really likely a leased space, and having that be flexible and just getting some more space than what we currently have. Just, yeah, a more ideal location for our clients. So just a big update on that.
And Kelly, I know there was a time frame that this had to be done in because of the lease renewal.
Yes, so then we talked last year about that. Our hope was to get out of those leases. I think North Broadway was just released, right?
North Broadway is end of 20.
This year, okay, yeah,
It was next year. North Broadway is this year, Westminster section.
yes. Yes, so ideally, we were trying to notify the landlords that we would be like discontinuing the lease after a certain amount of time, like usually it would be kind of a year's notice. And it would take us a year to do the planning to move into a new location. So that was the kind of the impetus last year for us sending that memo to the manager's office and really pushing them. That's unlikely, like we're going to end up needing to re-enter into those leases. And so lease breaking fees and things like that will be something we also have to consider in our number of questions. Potentially needing to get out of those leases. Yeah, So we will be just kind of looking at what our options are and, the planning process, like if we were to secure a location. And it would still take us about a year's worth of planning and actual moving of our location. So it's a long, pathway to actually be moving our location, but yeah, we're hopeful. I feel like that was some good traction, now that we have a new deputy county person.
We're looking at some shorter contract terms too for those leases, and so that way it doesn't have to be like long lease that we have to break, and could be like a shorter lease that lines up with the time frame. And about that year, depending on the location, year time frame that we're also including renovations we have to reach the site as well. And some of the sites are more renovated than others, so that would be cheaper and easier. But so we taking that into account for that.
There's a lot of discussion around county services being co-located with one another, like, does it make sense for us to be co-located with Head Start? Where, there's a lot of discussion too around, are there multiple things that the county can do with one location that includes us, but also maybe other things? So we're in constant kind of communication with them, but again, I think my talking points have really been like, they have big projects, obviously the jail detention center is one of those. And we're saying like, we're gonna be easy, like we need the set amount of space. It's gonna be a lease, like let us move forward with that.
Anyone have any other questions or input about executive director? Hey, deputy executive director.
A short one with the holidays. I don't have anything to this month.
Okay. Very short.
Don't expect it in the future.
I just had a comment on the director report that got sent out for the PDF. I really like the from Adam seeing the calendar or list of events. That's a really great summary of what we've done. Yeah, me just thinking a little bit too, plus what that I like what Diana was doing about kind of giving us notifications about like what we can participate in. Seems like there's a framework that's already there to like do something for public facing future events. I noticed our calendar's empty, but even like if you go to the main county websites, like pretty much all it's listed is like board meetings. So we were just talking about like going to board meetings and in terms of this, but I'd be much more inclined to go to a farmer's market or something and you can tie that stuff to the main county website with the awesome.
Yeah. So I think that's some stuff that we can talk about today in some of our goal setting for you all, and also as Sylvia Kamau Small and Yvonne come forward in February to present our favorite plans. How you all know.
Study session. First up is Jamie.
No, you can have my computer because I've already looped in. I have your slides all ready to go. I just have to screen share. And then you'll just take the computer.
Okay.
How's that?
Good.
Okay, so then you can just, as soon as that turns on, go ahead and move it to, auto mode and you're off. Well,
Touch screen, not doing.
it's a touch screen, yeah.
They got the fancy computers and ours.
I got the wide screen.
So hi, I'm Jamie Rodriguez. I think I've met most of you, but I'm the Regional Health Connector. I sit in Suzu Host Division and Health Equity and Strategic Initiatives. And today I'm going to talk about our Violence Prevention Action Team, which Levon is our executive sponsor on. So first, I'm just going to give you a little bit of landscape about violence in the county. So between 2018 and 2022, Adams County had higher homicide rates than Colorado on average. And 76% of homicides in the county involved a firearm. 2021 was our highest rate of homicides in the last 2 decades. And then all causes for non-fatal firearm injuries doubled over that time period. So really kind of brought home to us that violence prevention was really work we should be doing. So We had some perspective from youth, come out of a couple of different feedback sessions. So they were concerned about having, school and community mental health resources, communication from school leaders, feeling unsafe just in their homes, their schools, and their communities, and feeling the need to resort to violence in order to protect themselves, and then just a general feeling of disconnectedness from peers and communities. And then they also, which is really kind of great, understand that there's a strong link between substance use and violence. So we put together the Violence Prevention Action Team in January of last year. So currently working on violence prevention at the health department is me, Lena, who's here with us. And then Anthony, he is a newer role, substance use and violence prevention specialist. He's not here because he's getting married. So today's his first day off. But the three of us are kind of partnering up on this work to move it forward. So the Violence Prevention Action Team is like a I don't want to say disciplinary, what's the word I'm looking for? It's a community-led partnership. So our goal is to have the health department lead the work as far as making sure meetings happen and goals get met and really being the facilitator of the work. But the people that are on the ground doing the work are our community partners and our community members. So right now, within the health department, we have Levon, myself, Lena, and Anthony. Gabriella from Adam's team and her team are really doing a lot of our work on the data side. Kelly helps us with a lot of the evaluation stuff. And then we've added Libby. She's in our Health Equity and Strategic Initiatives division as our youth engagement coordinator. I'm so terrible with roles, but she's going to be really awesome in helping us engage and bring in the youth perspective. So our big community partners are Johnny Williams with Denver Youth Program, or GRASP, Gay Rescue and Support Program. They run a lot of really amazing programs throughout the state, and they're just a really cool partner to have. Jenny McCarthy, she's also with Denver Youth Program, and she's also a professor at CU Anschutz, and she supports the Firearm Injury and Prevention Initiative Program at CU Anschutz as well. And then Dr. Josh Cochran is with the Adams 14 School District. He is the COO of the school district, and he really works to oversee a lot of the safety issues that they have in the school district. We also have partners in the district attorney's office. So Alfonso Lozano is with the Youth Diversion Program. And then Karen, I'm going to butcher her last name, Schweiss is the director of the Criminal Justice Coordinating Council. And then in the government in general, we have McKenna Hines, who is the Collaborative Management Program, which is a group of health department, human services, schools. What else is in there? Nonprofits that are really looking at youth issues, right?
How to keep kids in their homes.
Yes, how to keep kids in their homes. And new, we've received commitment from Sharonda Appleberry, who is the Deputy County Coroner, and Paul Gregory, who's our Undersheriff in Adams County. So they started to join our work, and we have some really great advisors that are really knowledgeable and resourced in violence prevention work. So Jonathan McMillan is the director of gun violence prevention at Trailhead Institute, and he was our first director of the gun violence prevention office in the state. And so now he's at Trailhead. And then Dr. Beverly Kingston does a lot of research and work around youth violence prevention, gun violence prevention as well. So they are advising us, helping support us, and when we put programs into place, they'll eventually help us with evaluation as well. So all of that, what is VPAT? So the Violence Prevention Action Team was a grant that we received from NACCHO, the National Association of County and City Health Officials. So it was from January to July of last year, and they provided us with support to do a needs assessment and develop an action plan for Adams County. So we received support from NACCHO, from the Community Justice Action Fund, from CDC, and from the National League of Cities. And so what we did throughout that grant period, through that 7 months, is we completed the needs assessment. We really figured out what was the current state of Adams County. There was an in-person grantee gathering that actually happened here at CU Anschutz. We were the supporting partner on that one. So all the grantees came to Colorado, and we learned over a couple of days from a lot of really great folks in violence prevention work and seeing what's happening around the country. We had monthly individual and group-based technical assistance calls. And then we did this whole action planning process and sustainability planning process. So at the end of it, we came out with some goals and activities for our team to work on in the next few years. So it was, what do we want to see in, I think we kind of ended up on like 5 years. So these are the strategic priorities we came up with through that process. So the action team is working on these 4 priorities and then a whole bunch of activities underneath these. So it's building a path for ongoing, comprehensive, and holistic care for individuals and communities, strengthening supports to help youth and young adults thrive through leadership, educational attainment, and employment, developing a multi-sector ecosystem focused on sustained investment in the violence prevention over the next 5 years, and then strengthening family and community engagement to empower them to take action in their communities and with their government leaders. So just some examples of activities that we have identified that meet our strategic priorities. So for building a path for ongoing holistic care, we are compiling and mapping existing resources for youth and young adults. So with the help of Adam's team and with the help of the youth engagement team, we are partnering to do some youth listening sessions to really hear about like what youth are accessing and what they need and miss. And then we want to have like a whole entire interactive map where people can see and access all those resources. We want to identify what's already available in Adams County, youth serving spaces, coalitions, programs, what's working and what's available. And then we want to support our Denver Youth Program with their Reach Clinic development. So I actually just learned yesterday that they have opened one of their locations. The Reach Clinic is an outreach and support for people who have been in the hospital for violence, and it's bedside care and follow-up care after their discharge to prevent further violence. So Denver Youth Program, or GRASP, really spearheads that and are hoping to expand into Adams County. So we'd like to do whatever we can to help them expand into Adams County. For the next one, for strengthening family and community engagement, I think I talked about this a little bit already, but we really want to convene and engage youth in listening and feedback sessions. So with our partners at Denver Youth and with Libby and her skills in youth engagement, we really want to sit down and have youth guide us. What is it that they need? What is it that they want? What can we do as a health department, as a county, as community partners to really make sure that they are getting what they need out of their communities? So the first step is that listening session. We have already, I think they were in your packet, but we developed a couple of fact sheets already about just violence in the community. We have decided to focus a lot of our efforts on South Commerce City. And we actually just decided yesterday that youth in South Commerce City would be our focus. And then Federal Heights area, we would do just a general community focus for violence prevention. So we have the fact sheets already for Adams County in general, and then like the South Commerce City area. So we'll develop more fact sheets for other areas, and we'll use those to talk with our community and talk with our youth and use them to show what's happening. And then just utilizing community gathering models to engage community and inform leaders. So really wanting to bring community together and sit at the same table as leaders in the community. Leaders at the government level, and have dialogue and conversation about safety in their communities. We want to strengthen supports to help youth and young adults. And so again, identifying and engaging youth, young adults, and youth organized groups that can participate and be part of our action team, and also participate in the youth listening sessions. When we identify those spaces, that serve youth and young adults. How can we support them to provide resources and supports and continue their services and get more youth involved? And then just identify and engage existing meetings and coalitions that support and engage youth. Our goal is not to reinvent the wheel, it's to, make things more seamless. So if there's space out there already that people are working in, engaging youth, we want to work with them and not against them or in tandem. And then the last one is just developing this multi-sector ecosystem. So we're continuing our monthly meetings, and we work on the implementation of the action plan. So really 2025 is about implementing the action plan. So 2024, we developed it and we made a plan. Now we're ready to start working. We want to make sure we get missing and underrepresented underrepresented sectors and community members to the table, and then include elected officials and high-level decision makers. So who is it that can help us fund and make those decisions out in the community? And so this is a nod to Sylvia and the community engagement that you'll learn about. Or, well, not that you'll learn about, but that she'll present next month. But wanted to just share that where we're at on the community engagement spectrum as far as violence prevention is, like, I think Sylvia said we were in community ownership. I'm kind of leaning towards between delegated power and community ownership, but really letting community lead and us being the facilitator and the convener. And then just shout out to Dr. Kingston for this slide. Just the importance of making sure that in order to sustain whatever it is that we build, that we are using implementation science best practices and evaluating and demonstrating our impact to ensure the sustainability of it. Oh, sorry, I forgot that this slide was here. So for 2025 planning and implementation, so we picked our priority communities, the South Federal Heights, or South Commerce City, Federal Heights, North Aurora. We are supporting if we need to be. There's a lot of work already happening in Aurora. There's community organizations, Aurora Youth Violence Prevention. There's a lot already happening in Aurora. So we don't want to step in where we're not needed. So we'll support if we're asked to or if we're needed to. So we're just kind of keeping an eye on there. We want to make sure we're engaging law enforcement. Commerce City School District, Adams 14 does not have a relationship with the Commerce City Police Department right now. So we want to see if there's ways that we can facilitate that and bring the law enforcement perspective to the violence prevention action team and have them sit at the same table as community and listen to community and youth. And then doing the youth listening sessions. And then partnering with other county departments. So the behavioral health team and who else? Mostly behavioral health. Yeah, did a lot of suicide prevention month planning. So we want to, just bring all the departments in the county that are doing these suicide prevention month, child abuse prevention month, bring them all together and work together collaboratively for these awareness activities and events. Any questions?
What's your definition of youth?
That's actually not a dumb question, and we had that conversation in our meeting yesterday. So I think we have landed on youth. We're gonna do 14 to 24. There's a couple of different definitions, and then it'll also depend, like the activities will depend on, if it's like middle school, like maybe we'll have to tailor our activities to that age. But yeah, we're landing on 14 to 24 for now.
And then when you add in the youth and young adults, where do young adults and
Yeah, that's a great question. We actually didn't talk about that, but I think when we say youth and young adults, we're thinking up to that 24 age, so that maybe like 18 to 24 would be our young adults. I don't know, Lena or Levon, if you have any thoughts
Yeah,
on
the
that.
statute of the Tony Gramsci Youth Services statute speaks to in Colorado that youth question goes up to 4. And so we're thinking that encompasses what the rest of us say young adults, but young people really are up to 24 according to the statute. So we kind of landed there yesterday. The Division of Youth Services in Colorado, their statutes have young people going up to 21, and they broadened under the other statute. So we wanted to try to help as many people as possible and really just have a wide age range.
Any other questions?
Just really excited to see where this goes. Unfortunately, I see way too much youth violence that comes in through my emergency department.
Yeah.
And so just to see where this goes, especially coming from that Fed Heights community in South Commerce City.
I saw you all shake your head when we said Fed Heights, so.
Yeah. So
Yeah,
thank you for the work.
absolutely. Thank you. Thank you so much.
Thank you.
We lost Diana. I'm like, I'll give her her computer back. I will not touch the screen.
Very good.
The big word for tonight, Board of Health Policy.
Ready? Just into the executive row here.
Goal setting order.
Hold on, let me get my thesaurus out real fast.
Nope, this one's gonna be fun. And it doesn't have sticky notes, which goes against everything I stand for.
You don't have sticky notes?
I don't have sticky notes. I have one big sticky pad.
Be
So-
prepared for thinking.
Hi all, Erin Phillips with the Performance Management and Quality Improvement Program under Ops. We all met back in August and started this wonderful conversation around the Board of Health goals, what it is that you wanted to prioritize and focus your efforts on. We made a wonderful draft of a purpose statement and then things got busy. So here we are 4 months later, we're going to pick back up and start having those conversations. So when we did meet, we came up with this as our draft statement. Through leadership, governance, and advocacy, we serve our community by assuring the Adams County Health Department revolutionizes the delivery of all essential and emerging public health services. Jeremiah, Brett, and Dee Dee, you all had volunteered to get together and work on refining this statement. The words assuring and revolutionize were the two that didn't sit 100% with people. Did you all have a chance to do any work on this over the last 4 months? Perfect. So we still have a draft statement. I think there's still some work to be done to refine this for you all. As a reminder, the purpose statement is really what makes you unique and who do you serve. So why is the Adams County Board of Health different from any other Board of Health, and who are the people you serve? We have the vision and values for the health department that are on our website. We can send you, but your purpose should really help us to achieve that vision in the very long term. So that 20-year out kind of time frame. Are you three still the right three to spend some time wordsmithing and refining this?
Happy to.
Yeah.
Perfect. So I think I will get a note for Diana. But if you three can refine and finalize this, I can have Diana send it out to all of you with these slides as well. And then I can work with Kelly on what we do with the final statement. The other part, we came up with our 6 goal areas. So this is where we did some of the brainstorming with the sticky notes back at the hotel, and then did some of that kind of theming or funneling and putting things together. And we identified 6. That top one had an F at the very front of that underscore. Just because this is recorded, I chose to take that out for this purpose. But so we had that one, which was kind of this catch-all. We didn't really know where to put it.
We had a section on partnerships, a section on community engagement, which I think ties nicely into, I think it was Jeremiah's question around how to get involved. One on Board of Health Development, financial advocacy, and then finally workforce development. What I am going to ask us to do today is we have 6 right now. I would suggest we pick 3 and really make those your priorities for the next year or two. We can talk about timing in a little bit. And we will spend kind of the rest of my time building statements and thinking about what kind of actions. We came up with some stuff underneath it, but what does that look like? Who's going to do it? How do we do it? Sort of things. So I do have my big sticky note with the 6 of them, and I have dots to vote because I need something kitschy. But do you all need to have any sort of conversation around these to remember what it was you were thinking, where we were going?
Question.
Yeah, Melissa.
Does the support that we provide, I mean, it'll look different for each of these, but the agency is supporting whatever is chosen by the board?
I think that's the idea. I think we need to talk about it, but the main idea, these are the things that the Board of Health wants to work on over the next couple of years. So I think there could be some partnership with health department staff, with the people in this room, but it's really, what do you all want to work on and what does that look like from your perspective? Are these looking familiar?
Like, we're confused by that question. So these are like things that we want, like we want to be working on, or we want the public health department to be working.
I think we can have the conversation. I think we've gone back and forth on what it is. So what are your thoughts? Are these things?
Great question.
I was thinking like for something like partnerships, right? We're not, if that was one that you selected, we're not like, all right, go to the
Right.
CDPHE building. We would facilitate that to some extent. Here's points of contact, here's meetings that you could attend with us. For like working with other LPHAs, same thing, like all of our staff are working with other LPHAs. I am like, we would help facilitate that, right?
Would facilitate it, yes, and yeah, it like. I would say couching the answer with the fact that we already have a strategic plan and mission, right? And partnerships, for example, is really a great so it would be around, yes, like. It would be stuff for you all to do, essentially, but we would help facilitate and support those folks. So like goals for yourselves.
Yeah.
That then we can support through connections, facilitation tools, whatever you want.
And we can talk about, like, you all can create committees within the board,
Right.
and like a lead, and we could talk about, you know, meetings with staff to talk about these and or additional virtual
Subject matter experts on the team, yeah.
Or like requesting different study sessions or more information about how things are working.
Yeah, current state.
But in most cases, I envision you all being the actors. Support.
I guess I know we did these like based on some statistics, some of the like bullet points seem a little. Maybe we don't quite fit under, or maybe they do. I guess I'm trying to put like under community engagement, lack of awareness and advocacy for public health. Does that mean like advocacy goes under community engagement? Is that, you know, they're sort of separate things, but there's no real advocacy bullet? Like, I guess I'm all confused.
I think if I remember going back to that time, I think this, a little bit of our conversation around that was doing a better job of us getting out there and raising awareness of what the board does and what our responsibilities are, and being able to advocate for public health as board
Yeah.
members to the community. So
Yeah.
a lot of this discussion was how do we connect with the community, get their feedback? I remember kind of, we represent for the most part a lot of Western Adams County, but how do we engage Eastern Adams County in some different ways? And then helping people gain awareness for that bulk point specifically, gain awareness, because there's still a lot of misinformation around what we do
Right, and
or what the
so,
department does.
and so, I think, I remember we talked a lot about like if you ask an average person like what the public health department, they might be able to say like one thing, or if that, how do we like help to support that as board members?
Just, and maybe just to make the list, and that's fine because we did this as a group, but I think we've talked about doing more advocacy as a board, like the state level, and I don't quite see that on this, and we have that first thing that's sort of this weird catch-all, but, so I guess I don't know where that fits, or maybe it doesn't.
And it may fit into this. So these were just the brainstorm from August. This is not everything that it could be. So we're gonna pick 3 that we want to focus on. So I'm guessing from this conversation, community engagement is going to be one. We have 6, 7 bullets under there, but like, what is missing? What is your goal as it relates to community engagement? And what are kind of the things that you're going to do to help achieve that goal? So that might be some of the things that you were mentioning, some of the bullets that are not on there. And it may include 2 or 3 of the bullets on here, and the rest are kind of out of scope for right now. So this is a starting point. This is a resource, not the end all be all.
So we're saying, excuse me, learning to collaborate with other LPHAs, that could be with other boards of health as well.
And I think that's part of, what is the group that you support, the public health? Palbo?
NALBO.
NALBO?
National Association. Yeah, and I think
That could be a big part of this right there.
Right.
And
then it could also lead into the board of health development stuff too, and leaning in with that partnership of collaborating with other boards of health and also into our own development as well.
Question, if the board is looking at this and I'm going to look this up, say partnerships, so like I like the boards under it, but partnerships is not the right term. It may look for that and change the title of it.
We are changing everything on this sheet today. So this is a starting point. Yeah, this is a starting point that is going to do a 180 and may include the theme of what's under partnerships with a whole different kind of like title and maybe some more meat underneath it.
Early brainstorming.
Yes.
And distill further.
Much further.
Wordsmithing.
Yes. So once we pick our 3, we're gonna do sort of smarty statements and turn them actually into goals, and then figure out kind of what are the actions to achieve that goal. Do you all want to vote? I was gonna give you 3 fancy dots to vote for your 3 favorite. Or are there 3 that are automatically rising to the top and we don't even need to vote?
Yeah, that sticky dots are kind of like sticky notes.
So we have to do it, right? It would be a weird meeting if we didn't have something stuck to a wall.
I have my 3.
My 3, so I don't know that we need to do sticky notes.
We don't have to do it. It'll feel weird, but we don't have to. Somebody want to share their 3?
I can go. Partnership, community engagement, and board of health development.
Okay, we got.
I think like the only addition to that is I wonder if there's sort of a partnership in board of health development that could be combined, and then a third that's more like advocacy and understanding of our role in the political and other stuff that's going on, because I think that's an interest in.
Yeah, I agree. thinking about like what she was saying with the engagement and how advocacy was under that. I don't know
Yeah.
if that needs to be retitled or just
Right,
shifted
like
around or
maybe-
something, yeah.
Maybe advocacy fits into its own thing, or maybe it's in community engagement, but I think it's in there somewhere.
I think it's advocacy overall, and really the partnerships lead to the advocacy. Right, so if we're working on advocacy at the state level, really, it's also improving our relationship with CPH.
Right.
It's building the partnerships and something.
Not last year, didn't.
It didn't go, hopefully maybe, build some relationships there, but, to me, I think those kind of go. Those two go hand in hand, and then kind of collaboration with the LPHA's can roll over to the VLH development.
Okay.
So
I'm saying-
I'm thinking changing partnership to advocacy, is that what we're?
Well, it's different though, because if we're talking about partnership with other.
And yeah, I think they are different. But it seems like maybe the next activity is us getting a little bit more dialed in.
Yeah,
maybe
okay, so we don't need to go there.
It seems like we're going to take off the financial advocacy and workforce.
And the,
And the
Yeah.
like catch-all,
And-
well, there's a lot going on.
and some of those can be pulled into the other
Right.
three, so they're not completely gone. They can be a tool still. So what I'm going to have us do is break into 3 groups. So one for Board of Health Development, one for advocacy/partnership, and one for community engagement. Board of Health members, I'm gonna ask for 1 to 2 for each one to balance you out, and then Board of Felt members, I'm gonna have you all join as well. So Board of Health, anyone wanna call dibs?
I called it.
On which one, Melissa?
I'd like to work on Board of Health Development.
Alright.
I'm interested in the community engagement.
And then do the advocacy partnership.
Jump on community engagement.
And can we cross mingle?
There is a whole alignment section where you will cross mingle.
Always
We need to know
together.
what's gonna happen next.
I will show you in a minute. I have a whole handout that maps it out. So you'll be good. Well, do you want Board of Health Development or partnerships?
I'll do partnership.
Perfect. Felt members. Kelly, which group would you like?
You have to pick one, Kelly.
Kelly, we gotta choose.
Are you part of the NALVO? Tasha? Do you want to do the development part? Okay, Levon,
Community engagement.
Michelle,
We'll do partnership.
Darcy.
Workforce development's off.
It's off. It may roll into something, but it's off. Brian,
I guess we'll do partnership.
Michael,
For partnership for advocacy.
community engagement, partnerships, advocacy, and Board of Health Development. What? Development.
Whichever one has the fewest number of.
Community engagement, Bernadette,
Partnership and go there.
you're going, okay. Bernadette, which one did you want?
Partnership.
Perfect.
You're like, yeah, just-
Diana, do you want to be a part of this? So what we are going to do, so partnerships, we have Dee Dee, Sheila, Michelle, Brian, Bernadette, community engagement, Jeremiah, Brett, Levon, Adam, Suzuho, and Board of Health Development, Lisa, Melissa, Kelly, Darcy, and Michael. So we are going, not yet, we're gonna break into teams, and I have this super handy dandy 10-page
kind of guide that's gonna take us through the next steps. So we have taken the SMART or SMART goal format that you have probably seen everywhere, and we've revamped it kind of into this ACET tool that we're trying out. And it's kind of more of the Mad Libs format to build a goal statement. So I think it's a lot easier to think through each parts of the SMART statement, or as we're using ACET, before you try and put it together. And we do use the lean principles of respect for people. We really talk about equity and populations that may be impacted in this. And then we think about kind of that continuous improvement. So how do we measure it? How do we make sure we're actually achieving what we set out to do? So got some lean spins on it. We are going to use it to start out with at that goal level. So like high level, what is it you want to achieve in this advocacy or partnerships, development, or community engagement space? You do not have to use any of those words in your statement anymore. You can use some of the stuff, and I have these printed out as well, so you can have those in front of you. You can use any of those words in there, or you can, we have it written in here, you can use ChatGPT or any sort of AI tool to help you write this for you. So we're giving you all of the resources. Step one, we really want you, I want you to think about the action. Like, what is it that we're trying to do? What is that tangible thing that we're trying to achieve in Board of Health development? What does that look like? Then we'll move into what communities or customers are you really wanting to impact with this? So is it the Board of, or is it the Board of Health? Is it the residents? Is it the staff? Is it national level? Who knows what that looks like? And this is where you'll start thinking about the equity component of who's going to be unintentionally burdened with this work. You may not have anyone, which is fine. This one is kind of an optional. You don't have to have somebody in that space if it's equitable and nobody is going to be impacted. Then you're going to think about actually the impact. So this is where we're going to measure, where you're going to start thinking about that metric. So if it is meeting with LPHAs, you might think about how many LPHAs you want to meet with, or how would you measure the impact of meeting with them? Is it something with Michael Rodigan making policy level changes that you can actually track? And then you'll go into the time bound. So this is where I want to have a little bit more of a conversation. How long do you want these goals to last? I know you all just recently talked about your terms and how long you'll serve on the board. So are these goals that you want to try and achieve by December 2025, or are these 2 years? What time frame would you like to kind of be in the guardrails of?
Right, my objectives in my head is like, how long are you think gonna take? I think like 2 years potentially.
2 years?
Like, what popped in my head?
Yeah, that's kind of what I was thinking, for a few different reasons, but part of it is because of the uncertainty that we're facing, that we may have to shift focus or gears somewhere along the line. So I think 2 years is a good.
So December 2026, we'll try and wrap them up, or at least be at a really solid point to do another iteration. And where can we go on that next kind of venture, that next set of actions? Okay. Not everything has to end December 2026. You can have some of your goals end sooner. Then step 6, you will have thought through each of those questions of the ACET. So the action, the customer, the equity, the impact, and the time. And this is where the Mad Libs come into play, and the suggestion to use ChatGPT if you need any sort of wordsmithing, adding some Michael flair with fancy words, whatever that looks like for you all. So in the worksheets that I'm going to hand out to you, that gets us through step 7 on the worksheet. And then I am going to pause and we'll see where we're at with time and share out with the other groups and see where things may start aligning, or see where you may have feedback.
Sound good? Melissa, are we allowed to like break up and shuffle? Do we have to stay in the room because it's recorded, or can people
Yeah,
travel?
let's stay in the room.
Okay.
We are gonna keep the recording going, so just be mindful of that. I think if it gets too loud, we can break it up. Just as long as we're recording to the greatest extent possible.
Perfect. So what questions do you all have before we get started?
Yes, I was trying.
Thank you.
For the objective, it's just one objective, or does it
Right now, we're just starting with that high level goal.
high level?
And then we are gonna start breaking it down into the like, how do we actually achieve it? And then we'll get to the action level.
Okay, so the first thing we're just doing is
Just the high level goal.
okay.
Good to see you. All right, I don't know how you all want to break up, but if you need to remember which group you signed up for, I have it. Lisa, where are you taking the Board of Health Development group?
Board of Health Development, we're gonna go over that quarter.
So Lisa, Melissa, Kelly, Darcy, and Michael, you've got the couches.
Feeling you wanna hang over here?
Yeah.
All right, Dee Dee, Sheila, Michelle, Brian, and Bernadette, you're in the corner.
They don't have these.
Take your chairs with you.
Do you want to share my address? Do you want to
Next year.
this way?
Or to this, over here, yeah. This one, throw in the chairs, yeah. Make a circle.
Or 2027.
Have her back.
Need to stand anyway.
Yeah, but.
Step one, action,
What? This? No.
Part A is just gonna leave.
Yeah. Oh. It's rough. So it's set up. Oh, man. All right. Jeremiah, what did you say?
Well, part A is what's the main thing you want to work on? It's just community review. And then the other part B is
Well, I mean, under partnership, I think see what the first bullet point is approved relationship with CDPHE. And I think that's more about communication. That's my question, because CDPHE is huge. So what would you? From your perspective, from my perspective. I think that would be kind of our my perspectives, because I look at it and say, why are you guys micromanaging?
That's stuff too.
Works with LPHA.
Correct.
With. Yeah.
Is there a need or gap you're trying to solve for? So like, that implies the why, yeah, so that. People see your face in that one.
For me, working with this also. Free block from the western. I work 3 miles further away. I know that a hospital can be very well. And
I'm correct.
one to one.
Yeah, which is fine, because like, we have Brett and Jeremiah. Yeah, which we'll do that. Yeah. Perfect.
I was going to sit down and have a conversation with community members that are but also. I don't know that other than the data says, and what are their gaps? Do they know what we offer? And do I know whether are language barriers? We need to be able to close it down. Both the two-way side, we need better understand what they're doing, but also helping to be able to say this is.
It's not simple with like.
With that community, expression of very different.
Because that way.
I use the Eastern anecdote as an example.
Whatever.
And then that would be. Or there's some other areas. Then. I mean, high school. It's I guess for me, there's sort of very heavy focus on here, but are there opportunities for us to garner that feedback from them? Areas. And we definitely. I might be speaking of many of us are really each shop over again. And so that was kind of the other topic. I was just pockets around me that I don't always have this. So geographic section. I'm saying Eastern is just as an example, but yeah. Other communities or customers.
So like.
Pockets of.
Yeah, how do you?
Two.
Two.
That's right.
Yeah, 2 or less.
That expands, you know, the graphic for me. I work with them. Such a small component to it, so understanding. Some that are within that around, but I probably don't. Just a small.
It would provide the board a better understanding of what's going on. When we say something about.
Yeah, I think we all, I think kind of broader one is just helping in general, you know, like people every specific.
I don't.
Social media or how we do that.
I mean, I know, but most of the board doesn't.
Actually, we don't need to think.
Can we get back into that whole?
I mean, here's.
Yeah, COVID. That's
Right.
I was just thinking about that.
you're there, mate. You can think about all the reports.
Were you taking numbers? You had a note taking? Oh. Jeremiah's good.
A little bit.
Right up, customer. Where are you at? 2A, 2B?
Well.
I sort of started right about slightly different. There's. They would have us
I think one is trying to get the bigger picture for us to drill down a little more, so. Kind of like Strasburg, yeah, all of Adams County, and then be able to narrow it down to specifically who we want.
Based on.
That's-
Targeted.
Yeah, and
areas
that was one of the things that taught me by.
I mean, I think this is still the same, but it's very areas, but it's also just,
You know.
first I'm getting. Going to.
Especially when I can tell you for a fact they were not following the same rules.
Tailoring needs of those young people. We do. Take listening sessions.
But I read. I didn't actually.
Even just to get there. So one is that it's like get out and share. Help give it out and another is kind of, so it's. Those are the specific action that I think it's just different ways of being friends of clear.
Engage the CDC to get a better understanding. Insight into.
Yeah.
I think the answer is. Yeah.
And B, maybe we should skip the pre-seed.
Are there any natural, like, intercorner events, natural, if we're out doing some of these other events, what I see with my IoT, which is actually today, it's easily rush in. Because that's just going back to like conversation. It's really easy. How do we avoid where we're not going?
To
start there, I'm sure I'm on. Which is now very different. I don't even know any of that. But just being cognizant of or these things that we do that find ways to be able to get all the this one is that ultimately find that we're just our normal what's it's like that, what's considering you that we're not doing that. So I don't know that it's.
Right.
I think the same issue like this, depends on rural community being the part of the especially in the whole. That's good, but obviously. And everyone there.
Yeah, I mean, I remember the initial. Yeah, like right now I have, I told 3127, we'll engage in CMP to gain insight into their structure of decision making processes to. No, I'm just kidding. Yeah.
And there's the thing about how we raise the word out. People don't think that we
We will engage the CDPH to gain insight into the structure and decision making processes to.
But I mean, I do feel like a lot of. Help you.
They had no idea.
Or you can come to your heart.
Say that again.
You sound very excited. So. She thinks she did right. No, I mean, even like, that'll be, run a lot of.
So if the statement is by 12/31/27, will engage with CPHE, gain insight into their structure and how divisions interact.
The idea of other things we can tag, maybe it's not initially, so it's when you tag on video, be present.
That's my question. Is how do we know if they were successful?
Learn, is it partnering with some of the services that.
No, I just want.
With some of our.
Yes, I should get it in.
Maybe it's not the formal way in that way, but is there chance for me to go do right line and harm prevention to the traffic people that cost some of our clients that to do that interaction that way. Maybe it's not large events or we're just having on to other activities to garner that a little bit. You're right. Until we gaze it out there. Yeah.
I was also thinking like you're.
Like, what do you, you're meeting with them, so whatever, like, what do you want to say? Are we gonna see what they do and think, oh, we're gonna adopt that, or we're gonna see it, we're gonna say words. We'll see what they do.
Even if they're only like 2 people in the county that really care about what.
So you're gonna, I mean.
Sometimes, yeah, I think that's great. Every time we're here.
Especially that.
With L and how they work with LPHA, so that.
Yeah.
We
Where you
can
go
have a
and
better
discuss it.
understanding of the board. Is this a goal?
Yeah, what do you think?
Or is
Come join
it
our
an
team.
objective
Oh,
or
thank you.
achieve something?
I think that,
higher?
but, staff.
So you two, I think, know what I'm trying to say. I don't know that I'm saying it very.
Very scared.
And even.
Is this one of the things you want to do, and there's maybe 2 or 3 other things are gonna help you. The partnership, is it going to help? Is by doing this gonna actually help you establish different partnerships within the county or the regional level? Or is this kind of goal? Is this like a means to a higher end, or is this the end goal?
And, well, I'm gonna watch everything, so I was paying everybody, and if I can have the ability to do that, it's gonna be fun.
A different goal,
But like now, my time, so.
interacting with CDC better, and this is one way. Is in their structure.
Well, some staff have,
Yes.
but if we bring it to them, I think sometimes there has to be that, like, why would we have one
set up monthly meetings with the CDPHE, comment on the piece of structure. Today is a different way, like better. Increased communication, especially when. I am.
It's in the comfortability of when we do have seats that are available, yeah, all the guests.
I'm just wondering if there's something.
I can say it's really for that because.
And asking, and then there's like a higher. Yeah.
Presentations for our division.
I didn't say
There's,
eligible, but
like, I know them, I've met them and done other things, but there's still a big idea that comes to it. And it's still, oh my gosh, it's a vision team. Or today I had someone around from Nashville that was working with her. And I said, oh, that, so there's my jack and what, like, it's just a different feel behind it. And so you build some of those it's, I think that they call out. We had a whole conversation, we have this with the community. The fact that community is unique in that you have, they're almost like Russian accent also, yeah, the communities are. It's a lower time effort to move that county, there's also how we engage the community of the health. Community engagement is there's that community too that we.
Maybe that's one of the things is that we need to.
Well, I even imagine, oh, you go to like, that, you'll find her table. I mean, how should people realize that? I don't know how to watch that, but. And maybe it's just like, you know, they can't go that, here's, it's all the picture not out there. Building that.
So maybe there's a bigger goal that is a higher level that is not CDP. It's a little bit more generic and broad. And this one is one way that we can
We should put
achieve that
them on our
higher
floor.
level. Kind of.
Okay, and tell you, answer my 5 questions about the float, 5 or 6, is that right? And
Yeah,
questions
yeah.
about the float, float is on that at
We're
conference.
having. So Memorial Day, is that when we're doing Strasbourg Day or Memorial?
We're starting with Commerce City Parade.
Commerce City Parade, Memorial Day.
I got a
Okay.
I got the transfer. It's at the float.
We're doing it.
Let's do it.
Yeah, it's just.
It's a real thing.
Where we say, our needs are.
I don't know.
Yeah.
No, I think it's close.
I can't tell you, those are some of my favorite, living in Nebraska though, like all the small community. Parades and everything else.
We use a trailer and my family. She's got the trailer for designing it. Nothing common. We need to just invite her. All the things we're doing. Like even because we're, and then that can also
Around
be
that.
a natural way. to
And then you've got a
interact with our
speech
staff.
kind of way to achieve it, then you can write a local way to achieve it.
How many events did we do?
And those are like your
300.
Awesome.
objectives to achieve.
Isn't that right?
So we just need to get them on your radar, like you said. That'll be a good way to start. Darcy invited Dee Dee to the nursing group. We can also start doing that. If you want to come. We know you have jobs. But Friday and spent a couple hours and it's great. So we can.
But
Yeah.
the other day.
Mary told my schedule. Look at my camera every day, like, why do I have that? And sometimes I can't. Thanks, Mary.
Yeah.
But even if we had a goal to like,
I mean, that's.
you know,
basic thing.
get you to, you know, 3 division meetings a year, you know, that's something. That's a lot more than, you know, you can't create.
But I mean, that's something I. Continue doing. I'm kind of buzzing all over. It's also like. That's about over here. Like, bro, love of detail, like the people on the you know, the same thing. I'm board meeting.
Michael. That was different.
Listen, word.
Well, you could say,
How about if we said something like.
you can say like, have one board meetings. We wouldn't all kind of crazy.
I respect that.
But do one. We have space, we have contact. We can set that up. Yeah, we would have to pick a month that would be relevant.
Yeah.
But we don't have people show up.
So maybe that's what.
But we could say, yeah, we'll do one board meeting in Strasbourg.
I don't think we could consider it as walking by.
I mean, if we had, you know, we've got.
It actually might be easier for them to-
I think there's better, but there's really not internet.
But I mean, yeah,
But somewhere else.
I think it's so cool to me. You just bring in the immigration board. And then I would say one of the two.
Thanks for seeing. I also realized today I missed your call yesterday.
Oh, I was, no, it was today.
How was it?
Figure out. Show you on the invite for that. And I couldn't find it.
Yeah, I was thinking something.
Near the actual number there.
South
I
Carolina.
mean, you know,
Yeah,
Arapahoe
just-
and- well, I don't know if we're gonna read. Well, in Arapahoe, it's just-
This is-
I thought it was yesterday.
Yeah, we can figure it out.
and then I guess any other initial.
Yeah, yeah.
Number of. Nominations and stuff, regulators are- For me, I want to make sure that it's like on community benefits. Bring that good piece of the law, usually. One total community benefit. So normally,
+3 division meeting.
that's 7 times outside of our. And a lot of community events are on the weekends, I mean, to be honest, like, you know, I personally have issues with. What would that be? I'll bring about the little team. But see, that's a lot of community events can be on the weekends, some other ways that it's a. The big meetings, it's gonna depend on how. Scenario even. Even there's options sometimes to be able to. Ideally in person, but even if it's a virtual for some of those, just be able to. You know that they're still, we're still here listening, and be able to make it today, something, but.
Well, our all set meeting already planned.
Is it on the calendar?
It's on the calendar, it's all bold. On calendar, that's all day change, so maybe, you know, 2 hours in the morning. Additionally, Darcy's got for her division, all her staff and food is going to be out of your. That's pretty.
But I also really like to make sure. A really easy.
Yeah, I think it's just
like
easy
action from your fires. A survey.
Originally, what was to.
Yeah.
Promote. I think we can do something with that. One place I like. We have this stuff, being socialized a little bit.
Or just like. I wanted to make sure, that would be a lot of like, what other job?
You
Yeah,
know.
it was like 12 minutes.
So I probably got carried away. They say it's quite. You got the regional. I'm wondering if since say and then. Yeah, Bernadette, take care of it. You say, you do have enough school. Yes.
Once we finalize.
It says like
That
one
was,
one per quarter with these.
Yeah, for beginning, one per quarter, by the end of whatever year. We'll engage quarterly.
And everything's got a lot of. Certain. I do wonder about how to increase the awareness of them. So from that, or even just being able to
By
share.
12/31/27, I try to read my own scribbles.
We will engage with, we will engage quarterly with regional boards of health to improve understanding of challenges, share successes.
Yeah, I think that's what. Or work with.
And then you say mixes, but or coordinators.
There may be opportunity to. You know, since
Yeah.
now for media out there with, if we're doing a news piece on something that's coming out that it's. Kelly and Dee Dee or Kelly.
Yeah, yes, I keep going back to this.
Is it just learning from that or?
This is what we're gonna do.
So. They're all in challenge, they're all faces, like their faces, obviously.
Yeah, just my own, like, yeah.
I heard you.
Yeah, I learned something there.
Thank you for agreeing me for. Obviously, either
Let's take over thought.
That would be correct.
I know.
I
I know why.
Objectives.
Helpful.
And maybe not, we think about how do we break this down, is what are things we need to do to actually achieve that.
We need to make
Media.
sure. I invited you to our meeting. Session.
I think we did, it was, that was a tough one because we had the Smith at the same time. Cause I remember, one of my mattresses, my staff that were.
I remember, yeah, we had no parking at the school, we were in some like middle school. Yeah, they were in park and it was rough then, but. But we need to get that.
No, we're not on stage, that's.
Good for you.
They got rolled.
We're making it till 10, we're good. First,
Yeah, good job, so steps there.
This is our big goal.
So what are our goals? The goals are
Like the statement.
two Board of Health meetings at a different location, attending 3 events and attending 3 division.
Hugo's looking at this. This is our draft.
So then, what's the deadline on this? It's just like.
I think by, yeah, 1.6.
So I want to bring up that you still have the board retreat.
When is that? Who's going?
No, don't look on that. So you want to have an additional day.
What month is that?
You're ready to dock, you gotta work on that. Well, it's not that far. And so maybe if that's kind of your time is tight. Or if you want to have those 6 hours in the middle of time.
Yeah, that
June of 26.
Just because you all have other. Position jobs.
No, it's
Not one.
That way we're thinking, I think that's a great board, you know.
By 12/31/27, we will engage our districts. What are you doing more than?
When do we have the board meeting?
That will happen in June.
To improve our decision-making process.
There's an additional one.
I mean, we can work
today.
I think that's exactly.
Everybody knows what's.
Is that the one?
Budgets.
Wasn't that the one we heard?
That's an auxiliary one, so we always do one.
That's in
You always
the
want
happy, have a drink.
Correct.
Somebody's backyard.
But you have the joint established.
That's the one here.
That's why they were not super excited.
That was awesome.
Because I question.
I know.
You good? Well, I've got y'all, so I'm gonna dedicate this one.
I loved it.
Yeah.
It's really awkward. You got there. We're going
So
along.
that's what it's- and then it's just like-
That's exactly.
Yeah, yeah. We have to put it on the side.
Yeah, it's basically like.
We got it now.
Gotta go check my meeting.
Done meeting adjourned.
Yeah, there's
Maybe ask that over time.
Yeah.
Yeah, exactly. Get some sort of strategy. Or engagement.
No.
So we can meet with our comms and figure out.
Probably
We could get 7 new guys from start.
Yes. I like these, like, I mean, I know Kelly builds out going to be here, so that's potential to have.
Yeah, really.
Something kind of break down and.
Hey, you're in order.
We should try it. We're gonna have them share, and then we'll talk about what we do with this. And then we can say, or you can call it through. So you get all the power. I will. We have 2 expresses in this group, so I want people to go through it. Levi and Brett.
Yeah, that's what I'm thinking.
So if we're doing anything about. Something that you can think to that I care. Not free folks, many individual. We need to call back.
Yeah, call her, Diana. I'm sorry. Oh, I know.
He says we have 4 minutes. We're probably at 3 now.
Not 4 minutes. The phone's like.
Listen, Brian didn't make any coffee, so what am I supposed to do?
I can't speak.
Is that why you're melting into your chair?
I just decided there's a laugh. It's like I want to take this off.
They're way too comfortable. Yeah.
So what is Hussey stand for? Something we introduced. What? His answers are awesome.
Yeah, exactly.
My other problem is. And I don't know if he's trying.
Yeah, Angel likes to come in, and I can tell because I'm very scratching. That's the first thing.
Last.
And we saw a guy like snorting, just put my hand out, the editor.
But email.
She just may lay down. Next day, she was like hitting the side of the bed, but out of arm's reach.
I don't want love right now.
I'm just.
Officially, I'm not.
You get the freedom, but you don't get the love.
Yeah.
And so like.
You know, it's hard.
Yeah.
Even with all the action.
Are you ready to share?
Sure.
They were. I did.
All right, so I think all of you guys are at a point to share. I am just gonna ask that you all share your goal statement. If there's any questions by the other groups, here's your chance to ask. Then we will talk next steps. What do we do with these? And then Dee Dee says we have to go home. So, which group would like to share first? All right, Lisa's group.
You're gonna.
So for Board of Health Development, by the end of June 2026, we will strengthen the board's understanding of its roles and collaboratively design strategies to integrate this knowledge into actual initiatives that advance the Board of Health and the health department purpose statements. This will be achieved through attending 5 conferences, site visits, or trainings.
Like 5 conferences, what's the other thing? 5 conferences, like.
Site visits or trainings each year.
Right, so that you all would attend what?
One per person, not 5 each.
Yeah, Sheila.
Hanging out over the next.
The site visit is at a department.
Yeah, like potentially visiting another health department that's really innovative with equity focus. So that we can learn from especially outside of the state of Colorado and those people that are really cutting edge that we want to.
Any other questions, feedback? Everyone good with that one? And we will type these up and get them to you so you have more time to process. All right, which group next?
Hold on.
Perfect.
We came up with by 12/31/27, we will engage quarterly with at least one regional board of health to improve understanding of challenges they are facing, share successes and best practices to improve our decision-making processes. Needs wordsmith, but.
And this was the partnerships and advocacy group. Feedback, thoughts, questions?
Do we want to put any other entities on there? Just national, state, CalFO?
There was lots of conversation at this group
About that.
about that, yeah.
Maybe, I mean, we had similar conversations about like trainings, site visits. And make it an either or type thing.
Okay. Perfect.
Our brains are like.
They're still processing that. Yeah, they're still processing that.
Community engagement.
By June 2026, we will what's that? No, well, this is the technical action part.
Increased community engagement.
Yeah. Increased community, sorry.
Each of them has a piece of it.
Increased community engagement by hosting at least 2 of our board meetings on site in different communities across Adams County. Board members will attend at least 3 Adams County Health Department participating events and attend 3 Adams County Division meetings. And so the option for some of those, depending on people's schedules, will also be just engaging in social media. So meeting with the comms manager to capitalize on some of the, what are you laughing?
Nothing.
Around some of the strategic plan goals and other items that can be promoted
So I think this group thought more about the strategies of what needs to be done. There's still some work that needs to be done to build the actual statement.
Yeah.
But I think you all have some really good direction to go.
This is for communities that we are not regularly engaging with.
Perfect.
This is just like, what the goal is, that each kind of goal should be that the Board of Health members have to go do things.
No, but it sounds like you're doing a lot.
Just thinking, when we send these back out, is it also gonna come with bullet points of how we're supporting the board?
So there are next steps. We need to take these goals and kind of flush them out. This group has already flushed theirs out, so they need to build the statement to support it. I think you all have a lot of ideas of how to do this as well. And I know this group has started thinking about it. So we need to gather all of that information and put it in a document that Diana can send back to everyone, that it's all in one place. And then I think the next steps are fleshing it out further, figuring out who's doing these things. And then to your point, I think it's how do we, the health department staff, support these efforts.
Yeah.
So feel good? Yeah.
Excited?
Yeah, who's excited? We have a couple of years to do this. You're traveling every year, it sounds like, but you all good? It's a starting point, obviously more work to come. Perfect. So my ask for you is to give Diana or myself what you came up with so we can type it up and put it in a document that we'll send back out to everyone. And I will work with Kelly and probably Melissa and Diana to think about next steps and how we can get things together where we're not calling like official meetings because we have too many of you in one place or too many emails flying back and forth. So,
Or you can type it up. So, because I might not be able to read your handwriting, and then just email it to me. If that's easier. Yeah, just type it up and send it to me
I got it.
tomorrow, and then, yeah. That gives Adam an opportunity to formalize that a little more. Adam and Jeremiah.
That's perfect.
I just love Jeremiah and Suzuko in the background, like kind of feeding the words. Perfect. So more to come, but reminder, we have our purpose statement that 3 of you volunteered to refine, look at revolutionizes and assures, figure out if any other words need to take shape there. And then there will be an email with next steps for the goals and what we're going to do with this information.
So Brett and Jeremiah, do you feel like we need to meet to have that discussion, or can we do it by email, or?
Right, maybe we could do like a quick Zoom meeting or something.
And you can't do it.
I think
You can't do it. There's 3 of them. I can't do that.
I mean, you can call a special meeting at any point.
Okay.
and you just do it
I
on
have to
Zoom,
post it.
Okay.
Stream it, we can easily post it.
I have to post it.
Yeah.
But you can,
Maybe we can all come up with, take a stab at
Yeah.
it, and we can come reconvene over Zoom meeting. That would be okay.
you can, or send me your thoughts. I can compile things, send them back. I can be your kind of your in-between kind of person
But if
between
you
all
just
3
wanna-
of you.
if
Or
you wanna have a Zoom conversation.
Or if you really want to have a meeting, I just have to post it. So I can do whatever.
So let's do that. Good enough, but, yeah.
But we can do it by email.
No.
No.
It's-
Only if you have Diana.
You have to send it.
Only if you send it to me. Yeah, you 3 of you can't communicate ex parte like that.
So we'll send you an email about scheduling.
Okay.
And it's pretty simple.
It is. I can schedule a Zoom meeting pretty quick. I just have to get it, I have to make sure it's posted to the website.
So, yeah, so we'll all just kind of come with a. Yeah, but you started with it.
Yeah.
Okay. Perfect. Thank you.
Thank you. Yeah, thanks.
No stickies, but I think it was fine. We persevered.
She said.
Okay, We are over. Does anybody have anything else that we need to add on? Announcements? I don't see anything, so it's 7:40 and we're adjourning. Bye.